So I'm a gastroenterologist, and I practice and live in the suburbs of Detroit, Michigan. I'm a big sports fan.
He became the Rhodes Scholar representative as well as the homecoming king at Ohio State.
You know, what we're trying to do is replicate what you would have, for example, in my office. You know, we want to be real and answer questions that are tough sometimes. Take a topic and really understand it and develop a solution. At the end, we'll help the patient that's in front of us and also help the patients at home as well as the studio audience. That's the essence of what we want to do.
Welcome. Thank you for that warm applause. I really appreciate it. Thank you. And for those of you at home watching, thank you very much. Now today we're discussing alopecia, or hair loss. Now alopecia affects millions of Americans. It can refer to baldness called androgenic alopecia. You can also have traction alopecia with tight ponytails or braids. Alopecia areata is an autoimmune condition where the hair loss occurs in patches. The effects, even though not medically disabling, can be emotionally very challenging. Now, what causes alopecia? Normally, folks lose up to 100 hairs per day. With 100,000 hairs in your scalp, this is usually not a problem. Now, the causes of hair loss could be hormonal factors, which results in male or female pattern baldness. In certain persons, it can cause permanent hair loss as early as puberty. Now, medical problems such as thyroid disease, scalp infection, or even certain types of lupus can cause hair loss. Your body's own immune system can cause hair loss in alopecia areata. Now, you can use medicines. Medications for cancer, depression, or even heart problems can result in hair loss. Shock from a physical or emotional nature can also cause hair loss. Some people have hair pulling disorders causing their hair loss. Now, finally, certain hairstyles we talked about with the hair being pulled too tightly, such as pigtails or cornrows, can also be an important cause. Now, what about symptoms? What are the symptoms of alopecia? Most commonly, there's a thinning on top of the head, and some have smooth bald spots. Now, these folks usually have alopecia areata. With shock, there can be a sudden loss with loosening of hair. Full body hair loss can be from medical treatments such as chemotherapy for cancer or a type of alopecia areata. What about the diagnosis? How do you diagnose alopecia? As before, a thorough physical examination and history is critical. Lab tests can also be important. Sometimes hair samples can be taken which can give you some causes. Even biopsies of the skin can be done by your doctor to find out the reason for the alopecia. Now, once diagnosis is made, how is alopecia treated? Now, some hair loss spontaneously resolves. Often, medication can be used. Now, the treatment of the medical problem affecting your hair loss is critical. It's very important. Surgery can be used, but often is very expensive and can have complications of infection and scarring. Finally, wigs and hair pieces gives an alternative to medical or surgical treatment. Now, let's take a look at the story of Marjorie Bordenkircher, who has been diagnosed with alopecia areata. Please take a look with me.
My name is Marjorie Bordenkircher, and I suffer from alopecia universalis. That's basically total hair loss throughout the body. I, was teased by other children, so it's tough as a child to go through life being teased and not being able to participate in certain activities due to hair loss and the fear of your hairpiece falling off or being pulled off. It was hard for my parents to have a child with this. So, you kind of go through a little bit of guilt, if you will. And so it was hard as a child, but again, being an adult, I just want to be able to help other people overcome any problems they may have with coping with it, and let them know that, again, it's life-altering, but it's not life-threatening.
That was great. When we come back, we'll meet Marjorie. Please don't go away.
I was 2, actually, as my hair started growing and it started falling out. So my parents noticed spots of hair falling out of on top of my head, and they would describe them in size of coins. So they would say, they would describe it to the doctor the size of a dime, a nickel, a quarter.
We're back with you again. Now we have Marjorie Bordenkircher. Thank you for joining us.
Thank you for having me.
And we're going to talk a little bit about alopecia, but before that, could you let everybody know who you are?
Yes. Well, I know I'm here to discuss alopecia.
Sure.
However, alopecia doesn't define who I am. So I'm a proud mother of 2 daughters. I have an amazing relationship with a significant other, and I have a wonderful job managing Spa Mariana in Birmingham. So I have
That's
a very
perfect.
well-rounded, fulfilling life.
Great, great. Now, let's talk about alopecia. Now, tell me when you first had any symptoms that you could say was that was because of alopecia. Any symptoms of hair loss that you had? How old were you, would you say?
I was 2, actually, as my hair started growing and it started falling out. So my parents noticed spots of hair falling out of on top of my head, and they would describe them in size of coins. So they would say, you know, they would describe it to the doctor as the size of a dime, a nickel, a quarter. And of course, the more spots, the more concerned they got, and then they took me to the doctors.
So it was like smooth, rounded borders.
Yes.
Okay. And so they took you to the doctor, and what did the doctor say at age 2?
They said that they believed that it was due to stress.
Okay.
A 2-year-old.
Wow.
Yes.
Pretty stressful life. But obviously, so what did your parents do after that?
Well,
after
obviously,
de-stressing you?
and especially now, after being a parent myself, if you can imagine their concern, you want to do what's best for your children, and you want the answers right away. So they took me to several different doctors and dermatologists, and they tried, you know, everything that they could, everything that was suggested. I mean, to the point of having a cabbage diet, so I would eat a head of cabbage every day. They said that would make my hair grow back in. And then leaning my head.
But your parents loved that, huh?
Right, and I was sick of cabbage. I mean, up to here with cabbage. And then they also told me that if I leaned my head over the bed every night and they massaged my scalp, that would work, and I loved that. That was
Even
a good
better,
one.
yes.
I know, I was like, let's keep this going. But that, of course, didn't work. So just all these different types of treatments they tried, and they even tried the shots, and that didn't work as well.
What kind of shots did they try?
Cortisone shots directly in my head.
And didn't work at all?
No. Mm-mm.
And so let me ask you, so at age 2, you maybe had some symptoms of hair loss. How long did it take for them to make some diagnosis of this?
I think when I was about age 5 or 7, I actually remember.
So a few years.
Believe it or not, when I was in the first or second grade, I remember going to all these doctors and just having all these physicians standing around me, and they really didn't know what was going on. And I think it's come a long way now. I think a lot of dermatologists now, and even everybody is very well aware of alopecia. I think the more exposure and the more knowledge that we could.
Exactly. Even now, though, I mean, if you ask the general public if they know what alopecia is or alopecia areata is, I think that'd be difficult. I think it's it's good to talk about these things and describe the kind of hair loss that you had. Let me ask you this though: how old are you now?
44.
And so this is 42 years ago. That this was or 40 years ago, and so we've come a long way. I mean, back in those days, I'm not sure if they understood what areata was. I mean, so when you were given the official diagnosis about age 5 or 7, you think?
Yes, and that's when I had alopecia areata. I've had 3 stages of alopecia. I actually had alopecia totalis, and now I have alopecia universalis.
Explain to the folks at home what all these alopecias mean, totalis and universalis. What does that mean?
Alopecia areata is just spots of hair loss. So, for example, a man can have it in his beard area or on his calves, and you just notice spots of hair loss on top of your head, whatnot. And then alopecia totalis is when you have hair throughout your body, however, you do not have hair on the top of your head. And then alopecia universalis is when you have total hair loss throughout your entire body.
And so you went through stages.
I went through all 3 stages. Not everybody does, though.
Sure, of course. And in areata, like she talked about, these smooth, well-defined borders, and it's very different than other types of hair loss. It's pretty characteristic. Now you're a kid, and you have these problems with hair loss. I'm sure kids are pretty merciless. How did that work? How did that happen? What happened in your childhood? How did you deal with it?
Well, it was very difficult as a child. As you know, kids can be cruel, unfortunately, and a lot of bullying goes on and teasing. And I didn't wear a hairpiece like the one I'm wearing today. I actually wore a hairpiece that was similar to a hairpiece like this. And this is a synthetic hairpiece, and it's less expensive. It's more for short-term hair loss, not permanent or total hair loss. And if you look on the inside, it can get itchy, and imagine this getting all sweaty and hot from normal everyday activities. So as a child,
it wears out easier too, doesn't it?
Yes, it does. And heat can damage it. So if you're in the sun too much, if you're around open, fire or campfire. So as a child, you have to be very aware of your surroundings, and you can't, just go out and sit by a bonfire with your friends. You can't just go to the beach and be, baking out in the sun because you're damaging your hairpiece. And so your
head is on fire.
Yeah, and then plus you have to worry about it coming off, because these pieces, you have to have some sort of attachment, whether it be double-faced tape or any type
really?
of, yes, so to keep it, you know, secure on your head. So you have to worry about other kids pulling it off, and you have to worry about it just accidentally falling off if you want to go on the roller coaster ride.
Oh,
And
yeah, yeah.
you know, so it really does limit you, and it kind of holds you back from being a child and from doing stuff that you want to do. So I would say as a child I was very shy, and now I'm not shy at all. So I've come a long way.
I can't tell.
I know, right? So I've come a long way.
Sure.
As you grow up with alopecia, I think that it teaches you a lot of things. It teaches you who you can and cannot trust, and it's really a growing experience. And it also
You grow up pretty quickly, don't you?
Yes, you do. And you grow thick skin, and you actually. It's just very, for children, I think it's very tough. As an adult, it's a lot easier because you can have fun with it. You can have short hair pieces, long hair pieces, and the advantages of not having to shave, and all, you know, there's good parts to it.
Hold that thought. You know, we have to take a break. More with Marjorie when we come back. Please don't go away.
I hated going out for recess. Most children would look forward to recess, and I dreaded it because that meant there was more of a chance to have my hairpiece pulled off.
Welcome back. Thanks for staying with us. When we left you, Marjorie was talking a little bit about, you know, her alopecia, and I wanted to go back during your childhood. You know, maybe let the folks at home know it's very difficult to put into words, you know, what emotional turmoil you go through when all the stuff that everybody has to go through, that everybody can do, you can't do, and all the limitations. And did anybody ever pull that off?
Oh, yes. And as a matter of fact, it would get pulled off at school and thrown. I hated going out for recess. Most children would look forward to recess, and I dreaded it because that meant there was more of a chance to have my hairpiece pulled off. So they would pull it off, throw it in a puddle, and then they would send me home from school, like I did something wrong. And of course, then I went home and I felt really bad for my parents because my piece was, you know, damaged. We had to wash it again, and the wear and tear of it, obviously, with it being pulled off, you know, then they have to pay for another one. So it's just very difficult as a child. And also with alopecia, you're always trying to hide something. So it's like living with a secret. So it's very hard, you know, as a child too, to go through life trying to hide something or conceal something. And it's just easier as an adult when you can actually talk about it and be open about it and realize that it doesn't define you. It's just a part of who you are. But
did you ever confide in anybody that you had alopecia and then were let down by them and people knew that you had it?
yes, as a matter of fact, I was.
And that's what you mean by the fact that you learned that you couldn't trust everybody, and and that was pretty hard, huh?
Yes.
It happened.
And it makes you feel, at first it makes you feel bad about yourself, you know, and of course your self-image and your, you know, your insecurities and self-worth and everything. So of course you have those feelings, but then, you know, I guess it might be the way I was raised. I actually then turned around, I felt sorry for him. I'm like, oh, I feel so bad for you, you know, how bad that you can't, you know, deal with this and everything. And I actually turned it around and would, you know, use my upbringing, I guess, and pray for them and feel bad for them, you know.
That's nice. That's very positive. You know, and this is, I'm glad you're telling people this. I mean, whether it's with alopecia, whether it's whatever you're going through in life, and so you can approach it in two ways. Let it defeat you. And so you have a defeatist mentality, saying, you know what, I've got a mountain that I have to climb, and your mountain was this. You know, I can't do it. You know, it's too much. It's not fair. I shouldn't have it. Instead, you know, you turn it around and say, you know, that person, you know, I tell my daughter about the bucket fillers and the people with empty buckets. And you said, you know, in using a children's word, that those people had empty buckets, and they were trying to make you feel bad to try to make themselves feel better.
Right.
That's very, you know, it's wonderful if you have kids are watching, and you let them know this is a wonderful example of how you can take something that's all this adversity, turn around and make you stronger. What about, and I want to, I'm sorry if I'm asking you some personal questions, but what about dating? You know, let me tell you, you're a teenager and you're an attractive young woman and you want to date whoever, you know, some cute guy or something. What happens? I mean, how often were you asked, and did you have to worry about those kind of things?
Yes, you know what, actually you would always worry about them touching the back of your head and feeling, you know, again, I was wearing these pieces for many years, the synthetic pieces, and that I had showed you earlier. So if you could feel it, it feels like it's a hair piece from the back. So you'd always worry about them noticing, and then what were you going to say, and
what did they
how
say
they
when
would
they
take
noticed
it.
it?
they would just ask, why is it like that? And then people would ask about my eyebrows because I would pencil my eyebrows in, and so people would ask, and then I would tell them and see how they would take it. And it was very important to me to see their reaction and to see how they responded to it.
To see if it was anything that could go further, probably, right?
Right.
That wasn't superficial. And finally, so what did you do to cope, and what would you tell, you've been through this for a long time, what would you tell America about, your condition, alopecia? Because lots of people at home, in America and outside the U.S. have maybe never met anybody with alopecia, don't even know anything about it. All they know is maybe it's this baldness. What would you tell them about that?
I would tell them to know that there are doctors out there, there's dermatologists that you can go to who can help you medically deal with your situation, and to get advice from them, because different types of alopecia, there's different types of treatments.
Depends the type of alopecia you have.
Right,
We talked about all the types and everything, but specifically your condition. I mean, areata, and what would you say about that?
Well, it's nice because hair pieces come a long way over the years. So again, when I was younger, I wore a piece that was like this, and it was synthetic, and it was itchy and irritable, and you have to wear all these different types of attachment. But nowadays, when you have alopecia or any sort of long-term hair loss, then you can have a custom piece made like the one that I'm wearing right now. And this is a clear cast. So you get your scan of your head and done with a computer, and then they come back with this clear cast that's a perfect fit for your head. So it doesn't fit anybody else, it's completely custom, and you do adjustments if need be to make sure that it fits you properly and it's comfortable. And then they'll also send you, and then they'll also send you a hair sample check and make sure that you're happy with the color that that you've chosen. And
it feels pretty natural.
Isn't it nice? It's human hair.
It's human hair.
Mm-hmm.
Now, is this in the U.S. or where do you get it from?
Actually, I go through a company that's based in Chicago, and they get their hair from overseas. They get their hair from Europe and
if you didn't tell me, I would never know that your hair is synthetic. I mean, would anybody here that's looking, would any of you know that hair is not real? You can't really tell. It looks wonderful.
And if you don't mind, I'll show you. I can take it off. And
that'd be great,
pop it back on. So what you do is you just release the suction, and then you take it off. And as you see, this is the that's the same exact one that was taken of my head. So it fits perfectly, every nook and cranny of your head, and nobody can pull it off.
You can see it. Well, it's interesting, and it stays on. And how about, can you go on a roller coaster with this?
Yes, and I can go in a convertible, and I've gone tubing.
Convertible?
Mm-hmm. Yes.
Nice.
So you can do whatever you want to do. You can live a very full, happy life, and you don't really have to let it. You don't have to allow alopecia to rule your life. You can do what you want to do, and you can live a very fulfilling, happy life. And
can I say this though? And hopefully everybody here can agree that she looks beautiful with and without this. So it's a super round of applause. You do. You're wonderful. I'll give this to you. So important lessons that Marjorie's given us. Number one, that I think the most important one is that no matter what your condition may be, if it's alopecia or something else, it's your approach. It's how you approach it and how you say, how are you going to determine how it's going to affect you? Are you going to let it stop you, or are you going to defeat it and be the beautiful person you are?
Thank you. And it's not life-threatening. It's definitely life-altering, and it's a loss. So any loss is very hard to deal with.
Absolutely.
However,
great tips.
you can overcome it.
Great tips. Thank you for taking the time and sharing those experiences with us. I really appreciate it.
Thank you so much for having me.
When we come back, our dermatologist, Dr. Wendy Sadoff, joins us. Please don't go away.
I remember a patient who had their wig pulled off when they were at the roller rink, and they became, so acutely stressed, depressed, suicidal.
Welcome back. Thanks for staying with us. We now have Dr. Wendy Sadoff. Thank you for coming.
My pleasure.
And we talked about other topics before, but today we're talking about alopecia. And what is your definition of alopecia? People often see that word and they have no idea what that means. What is your definition?
I would just say it's a general term for hair loss. So really it encompasses a huge number of different reasons and different clinical presentations of hair loss. So it doesn't tell you more or less than just the person has less hair than they did. It could be hair shedding, hair, where there, or patches of hair loss, or scarring, or inflammation, anything.
Okay, perfect.
Covers it all.
So basically, your definition is hair loss of any kind. It could be the male type baldness, or even the areata we talked about. So it could be anything, any of those
Exactly.
conditions. How commonly do people come to see you in your practice for alopecia?
I see it a fair amount.
Okay.
And again, for many different reasons. A lot of times men are just noticing that their hairline is looking more like their father's or their grandfather's, and they want to know if there's anything that they can do for it. Very common are women who are thinning out and just gradually having less and less hair to work with and cover certain areas of their scalp, and having more visible scalp. And also, alopecia areata, very common.
See them earlier, don't you? Probably.
I do, and sometimes it'll be a young man with a little isolated dime-sized hairless patch in the beard area, or it can be more extensive. So encompasses a wide range of severity or areas of involvement.
Sure. And the thing is that lots of people come to you with alopecia in different stages. If you had to say, if I have alopecia, when should I come see you, and when should I just be seen by the general doctor?
I think all alopecia should really go to a dermatologist, and granted I'm biased, but
Sure.
I think that we're really schooled in the evaluation of hair loss and addressing whether it needs a biopsy, whether it needs blood work, whether you can just give reassurance or any further workup. So I think that everything should really come to, unless you just kind of a man is starting to lose hair, his hairline's
Sure.
extending. But even so, we really are very familiar with the medications and the limitations of treatment as well.
Yeah, and so it's an important answer is that you should see, if you have any questions or doubts about it, at least get an opinion from a dermatologist. They can give you some options and maybe let you know early on, even if it's just simple male type baldness, something simple. It's not very simple when you have it. That what kind of options are out there? Now, Marjorie talked about, at least initially, her condition of areata, so alopecia areata. How often do you see that? Is that very common?
It is very common in the population, 2-3%, and it's, again, can be very limited involvement. Someone may not even be aware that they have it. If it's a very small patch of hair loss, it may be picked up when they're getting a haircut. Someone says, oh wait, you're missing some hair here. So it may not be very debilitating or very noticeable, or it can be much more extensive.
And then
certainly her case is a more extensive, involvement.
2 to 3%. I mean, if in the United States, that's up to 9 million people, and that's quite a few. And so we need to really, as healthcare providers in general medicine, really be aware and try to recognize what this is, and have those folks go to dermatologists so they can get the treatment they need.
Right. In the beginning, an area of alopecia areata and an area of ringworm of the scalp can look very
Identical,
similar.
yeah.
So you certainly want to have the
a great
correct
point.
diagnosis, because your treatments are very different.
Exactly. And so, it's important for us to get educated. And I think more and more people are getting educated, but it's important to know how many people can really have it. Now, when you have alopecia, it's clearly not, for most people, it's not physically disabling. It's not hurting you, and it doesn't seem to you can live with it, but emotionally can be extremely, extremely troubling. And what do you do that? And I'm sure when you see those folks with alopecia, your job is partly to treat, but also treat the mind. I mean, what do you think about that?
It's extreme. The psychological impact of hair loss in general is extreme, and it's not always related to how much hair loss it is. So someone with very imperceptible hair loss can be much more affected even than someone who has a more severe case. It's not always correlated to the severity of their condition. It's extreme, and especially for children. She recalled just some really emotional times,
Horrific
and
things.
that is more common than not. I remember a patient who had their wig pulled off when they were at the roller rink. And they became, so acutely stressed, depressed, suicidal. It's
wow.
and they have tremendous feelings of isolation. I mean, how many kids are really wearing wigs at that age? And it's so
That's
isolation, depression. But on a positive note, there are really amazing resources now that maybe they didn't have when she was younger.
The support groups,
right,
too, right?
The support groups, the National Alopecia Areata Foundation,
They have a great website, yeah.
amazing. So really good educational resource and support.
Yeah, and
those
so
kids.
again, and for parents, and even if you have people in your school or colleagues or friends that have alopecia, whether it's areata or not, it's important to understand how devastating this can be, psychologically, emotionally, and how much we have to support them. It's kind of, it's fun, for kids. They just don't understand what the consequences are. But if you have somebody in your school or in your sphere of friendship or family, it's important to recognize that. And when we come back, we'll talk more with Dr. Sadoff. Please don't go away.
If you can give some educational piece so they can at least be somewhat of an advocate or aware of their condition, that helps some. But some you cannot console and you cannot treat. And if the person is that upset, I think that it's good to work in conjunction with a therapist.
We're back with you again. When we left you, we were talking about alopecia with Dr. Sadoff. And, Dr. Sadoff, when you have alopecia, we talked about some of the emotional aspects, but when you have a patient come in with alopecia, what's your approach in those patients?
First thing is to get a history and find out whether they're just noticing that they have less hair, like they put all their hair in their hands or in a ponytail holder. Is it just slowly becoming less and less, or are they shedding? Do they have an active hair loss process where they're just picking up hairs everywhere? Have they noted bald patches? How's their general health? What else is happening emotionally in their personal life, in their occupational life? And then, of course, to do a complete exam, not only of the scalp, but of the rest of their skin.
To try to get an idea of exactly what's causing it and what pattern. That's
Right.
great. Go ahead, I'm sorry.
So that would be the first thing, to do the proper history and exam. And it's really important because there are even some situations where a person might be severely iron deficient or have a history of iron deficiency, and that could be playing a role.
Sure.
So it's really a more extensive history than you would think for a skin problem.
That's great, and some important points for those of you watching at home is, number one, try to find out what type of hair loss. You talked about, is it coming out in clumps? Is it sudden hair loss? Is it coming out as Marjorie said, in those nice circular areas? And it gives you clues on why it's happening. And once you know why it's happening, as we talked about, alopecia is a general term, which just means hair loss. Once you know the underlying cause, and you can treat it. So, and Marjorie was very eloquent. What did you think of her story? I mean, she's extremely courageous and I just want, what do you think about her story?
Well, the one word would be inspiring.
Yes.
I think her story is amazing. And she gives a pretty typical history of a young patient with extensive alopecia. So again, that psychological trauma, the isolation, the torment, but what an outcome in terms of her strength. So thank goodness.
She comes out so strong. I mean, really, and it was wonderful what she said was, I felt bad for them, that they had to do this to me, which is really unbelievable.
We could figure out a way for people with not only skin conditions, but other conditions where they're affected and
react in this
different, whatever,
manner.
that they could understand that and kind of react that way. Yeah, absolutely. So very inspiring. I think she's amazing. And unfortunately, not all kids end up with that strength as adults.
Sure, because they're
And it
vulnerable. They're vulnerable at that age,
Absolutely.
right? Yeah.
It affects their ability to socialize, to date, to pick certain occupations. So it can be very devastating.
And it can't be stated, with more emphasis, that what she did and how you can extend that to other parts of your life. It's really, I like that word, inspirational, and that you can take that lesson and extend it out and say, this is how I can approach it. Now let me ask you, as a practitioner, as a dermatologist, what's the most difficult challenge in having these patients with alopecia? What's the toughest thing you have to do?
Toughest thing is limitations in terms of treatment options. I mean, it'd be great if once we made the diagnosis, there's, you match it up with the treatment and you've got a excellent prognosis. But unfortunately, many types of hair loss do not have a really great prognosis or even treatment options. So it's more, we try this, we try that, we hope for the best, we offer certain things. the most, certain things have good prognosis. So let's say someone is having a psychological or a physiological stress and they start shedding their hair. That may have a very good prognosis. Hair grows back. It's just the shock to the system, and it's called telogen effluvium. It's a type of hair loss, and hairs that were just staying in the head, kind of resting, all of a sudden fall out, but very good prognosis. So we tell those patients, just reassure them, and they have a good prognosis. Alopecia areata with coin-shaped small patches, we inject with cortisone, they do great. But male pattern hair loss,
Tough.
Some forms of what we call scarring alopecia, where you actually are replacing the follicle with scar, you can't grow a hair there because there's no follicle for it to emanate from. So again, the limitation of treatments.
And we're getting better.
Getting better. It's hard to not offer. We want to make everyone better, and it's really hard to say, we know what you have, but I can't make you better. I think that's the
You're a good
hardest.
doctor. I think you really care and you feel for your patients. And in that vein, how difficult is it to treat young people or even older people with the emotional part of it? I mean, listen, we have injections, we have treatments, medical treatments, but how difficult is it for you to see these people devastated from something that may or may not get better? I mean, how do you deal with that?
Well, I think it's on an individual basis. Some people can be reassured, and with information and reassurance that you're not going to go bald or something, even that, because a lot of women think they're going to go completely bald, and you can just say that's not going to happen, and you can reassure them and give them some education. I think if you can give some educational piece so they can at least be somewhat of an advocate or aware of their condition, that helps some. But some you cannot console and you cannot treat.
Right.
And if the person is that upset, I think that it's good to work in conjunction with a therapist, because there's that mind-body connection, and the stress over the hair loss is only going to make that condition worse. So.
Absolutely, and you said it very well, and I firmly believe in this mind-body connection, in the sense that you can't just treat the body alone. You've got to treat the mind, especially in conditions like this. And and for us who are healthcare practitioners, healthcare providers, you can't always do it alone, and you have to have partners and good partners. So if you're watching, always get a good partner that can treat these folks. Great advice. I appreciate it. We have to take a break. When we come back, we'll take some questions from our studio audience. Please don't go away.
Any treatments, but oftentimes when you find a condition that has many treatments, not all of them can work really well. The standard treatment, injection with cortisone, actually does work well. And also sometimes the body on its own, without any treatment, that hair will fill in.
Thank you for coming back. We now have some questions from our studio audience we're going to answer. Are you ready, Dr. Sadov?
I am.
Perfect. Next question.
Hi. I was just wondering if alopecia areata can be reversed.
Well, it's a great question. So what happens is, if you have the hair loss, and usually it's in smooth areas, smooth clumps, and when that hair is lost, can that be reversed?
Absolutely. There are many treatments, but oftentimes when you find a condition that has many treatments, not all of them can work really well. The standard treatment, injection with cortisone, actually does work well. And also sometimes the body on its own, without any treatment, that hair will fill in. So when you say the condition is not cured, it's not reversed,
you control
but can individual patches regrow hair? Absolutely. And the earlier you treat and the more minimal the disease there is at the time of treatment, the better the outcome is.
And so the answer is the hair follicle still has the potential of regrowing hair. It's not that there's scar tissue and permanent damage. And that's something that people think, because it's smooth and it's not the same kind of the hair loss pattern that lots of us are aware of, we think that this is not going to come back. And what happens when it becomes more extensive? Is that a different story? Do you get, is it possible to regrow hair then?
It's possible, much less likely. The more hair that is lost, the less optimistic we are about regrowing hair.
Yeah, so the idea is, again, like every other disease we treat, try to get treatment early, see your dermatologist. And often, we're seeing our family doctor, but you may have to do more. You have to see a dermatologist. Are there general doctors that can treat areata? I mean, do you think that all patients with alopecia areata have to see a dermatologist?
I'm biased. I would say yes. I also think that the critical reason to see a dermatologist is to make the diagnosis. There are mimickers of alopecia areata, and you have to find out exactly what type of alopecia it is. Is this an alopecia where there is still a viable hair follicle that can grow hair? Or is there hair follicle death replaced by scar? Is there inflammation? Is there a better treatment for it? Is a biopsy necessary? And I
Lots
think
of
that
questions.
There are, and I think that a dermatologist should be the one to evaluate, because when we do those biopsies, we take a biopsy in a certain way, in a certain place in that hairless patch, and we process it in a very specific way and send it to a very specific skin pathologist. So all those connections, so that we can get the most information back.
When do you do a biopsy? I mean, just because we don't do biopsies on everybody, when is a biopsy necessary for this condition?
I think when there is any diagnostic dilemma. I mean, there are cases that are very clear. Most of the time, it's pretty clear that it's an alopecia areata patient, but there are times that the diagnosis is less clear, and it will give you not only information to give the patient in terms of their diagnosis, but their prognosis, and give you an idea in terms of some treatment options that you might have.
Perfect, great advice. Thank you. Next question. Yes, sir.
Hi, for male pattern baldness, how effective is surgical therapy?
You know what, surgical therapy can be extremely effective, you know, if done in the proper way, in the right hands. And that's the key, isn't it, Dr. Sadoff, is that to find the right surgeon and to find the right person that deals with your hair loss so that we can get the adequate effects. What do you think about that?
We have to find the right surgeon, and you have to have the right patient. There's an appropriate patient. Not every man with male pattern hair loss is a candidate for hair transplants, but a good candidate and a great doctor, I mean, you can have a really nice result.
Who's a good candidate?
Well, you know, where there's some forehead recession
Yeah.
is a great candidate, but if you're going to end up with kind of that friar tuck fringe and you are going to end up with then you're not a good candidate, because you're going to end up putting some hair transplants in the front and then losing so much around those transplants. But if you are just kind of that where your forehead's getting a little higher, there are some great techniques using small numbers of hairs. So the results over time have gotten better and better also.
And how do you go about it? Like, how people at home are watching saying, you know what, how do I find the right hair transplant? You see all these advertisements on TV. They all claim they're just the best ever, you know, surgeon or technique. How do you find that?
It's a really good question. I think it's like finding any other specialist, a plastic surgeon or whatever.
I'm sorry, could you hold your thought 1 second? We have to take a break. When we come back, more with Dr. Sadoff. Please don't go away. What's out there that's over the counter that actually can work? Because there's claims all over that it can go. What do you think can work?
The only thing well, Rogaine is over the counter, and there is evidence that Rogaine can work. It's not going to work in everyone, but the risk to using it is very slight.
Welcome back. Thanks for staying with us. When we left you, we were answering some questions about alopecia, and we left off that you talked to us about finding the right hair transplant surgeon. Can you tell us a little bit more? I'm sorry I interrupted you.
It's okay. I think it's like finding any specialist. You need to ask a lot of questions. You need to have multiple opinions before you go doing anything surgically for your for the male pattern baldness. So there are great people around. It's just get different opinions, get references. We're a good place in terms of a dermatologist can direct you too.
And if you have some questions, it's difficult. You know, in my mind, when you go to the web or you try to get information, it's hard to know where this originates from when you go to some website. I think the best spot to me would be go to your dermatologist that you trust and have your dermatologist say, this is the person I would go to and this is the reason why. Right. So
we also could maybe say, no, you're not going to be a candidate, and kind of save someone some time, maybe offer them other lots of money, and offer maybe other options, Rogaine, Propecia, things like that.
Perfect. Thank you. Next question. Yes, sir.
Does shampoo affect male pattern baldness?
There's a lot of information that people have about that, and it may help. What do you think about that? Can it help with or even affected in any way, male pattern baldness?
Well, people are worried that some shampoos will cause hair loss and others may help with hair loss, and they're really not that powerful to do either. So whatever shampoo you like to get your hair clean and your scalp feel good, it's fine. It doesn't cause, no, there's nothing, it's all inside, it's under the surface, so shampoos aren't going to make a difference, and hats, nothing else.
Put those hats back on, that's right. No worries, right?
Right, right.
Next
Wear your
question,
hat.
yes.
Hi.
Hi.
Is early treatment for typical baldness effective?
You know, it's a good question. What do you think? I mean, early treatment for any disease we think is usually better than late.
Right.
What do you think about this problem?
Well, it depends on what the cause of the baldness is. If it's a woman who is thinning out, yes, there's some limited treatments. It's always better to catch something early. And so alopecia areata, yes, if you've just got a few patches, easier to treat. Male pattern hair loss, the results are going to be better with some of the topical or the Propecia, treatments. So yes, early treatment it really is key.
And for male pattern baldness, are there any for those of you who are watching, saying, what can we do? That's very common. What can we do? And what's out there that's over the counter that actually can work? Because there's claims all over that it can go. What do you think can work?
The only thing Rogaine is over the counter, and there is evidence that Rogaine can work. It's not going to work in everyone, but the risk to using it is very slight, other than maybe some irritation. So I advise Rogaine. I think try it, maybe a 6-month trial of it, see if it helps you. Other things over the counter, I mean, we sometimes recommend biotin. So again, there is some evidence that biotin can help with hair growth and, again, safe to use. So no reason not to try that either.
And again, another reason to see your dermatologist, because you can get all this wealth of information and not have to guess. So perfect advice. Next question, yes.
Hi.
Hi.
Is alopecia areata hereditary?
It's an autoimmune condition, so people think that there may be some hereditary or genetic components. What do you think?
Definitely, we see families where they have that. But again, like I mentioned earlier, it may be that one member of the family has an autoimmune thyroid disease, another has alopecia areata. And it's not certainly that everyone is going to get it. If your mother has it, you're not, guaranteed to have it. So, and there's so much anxiety surrounding hair loss that I guess I wouldn't want someone to say that they're destined to have it just because they have it in their family.
It's just, it's like a lot of other conditions that are genetic. You may have a predisposition, which means that you may have an increased risk, but it doesn't mean you let it control your life. Don't let it, worry you. But however, if you have another autoimmune condition, you can see, okay, there's some genetic basis to it. But it's not going to affect how you treat that individual, right?
No, and it could be a good thing that they're aware. So if they notice it, they'll get it treated earlier. But again, not to live with fear that when's the hair going to start coming out.
And the other key point that you made is that it's such an emotional or psychological damaging effect, when you have hair loss, because society values that, the appearance of it. I mean, there's nothing wrong with that, but I think all of us, fear in society that when you lose hair, and then if you give them another idea that maybe you're destined to lose hair, just a little bit more emotion and anxiety that goes along that's unneeded. So I think we can be aware of it as a knowledge base, but I don't think that it makes it any different. You don't do anything differently. You don't start using cortisone injections or shots. You just
Nothing
be aware
preventative.
of it. Exactly. That was great pieces of advice. Thank you very much for taking the time with us and answering those questions. Please don't go away. When we come back, Partha's Prescriptions. Welcome back, and thanks for staying with us. Today we've discussed alopecia affecting the lives of millions of Americans. What can we take away on today's Partha's Prescriptions? Number one, there are lots of causes for hair loss. If alopecia is affecting your life, please consult with your dermatologist for solutions. Number two, the emotional toll of alopecia can be significant. Join a support group to help cope with your difficulty. Number three, be careful with hairstyles. Certain hairstyles, including braids, ponytails, and hair extensions, they can pull on your hair and cause hair loss. Number four, remember that stress can cause temporary hair loss. For most of us, nothing more needs to be done. The hair will start to regrow without any help. For more information on alopecia, please visit our website at www.askdrnandi.com. Also, you can join the discussion on our Facebook and Twitter pages. Just search Ask Dr. Nandi. Now lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you. Thank you for watching and see you next time.